cytogenetics is very important, as anyone know who treats AML. Depending on the type of cytogenetics, it gives patient prognosis. All the risk stratification include cytogenetics. So people with like core binding factor, for example, that favorable risk. People who have very complex cytogenetics have adverse risk disease. So a lot of times when people have adverse risk or complex cytogenetics, even if they are young or a intensive chemotherapy candidate, because we know the response is not very good, and very complex cytogenetics oftentimes associated with TP53 mutations. A lot of times the upfront treatment, we would use more of a HMA in combination of Venetoclax approach. Whereas patients who have intermediate risk cytogenetics or normal cytogenetics, these young fit patients, we would do more traditional intensive chemotherapy, such as 7+3 or Vyxeos, depending on if they have therapy-related type of AML. And then for core binding cytogenetics patient with favorable risk, most of us, we would add Gemtuzumab to the 7+3 backbone for induction. So yeah, I think cytogenetics is very important and really help us choose what is the most optimal regimen for patients.